Welcome to the Nightingale College podcast in the Nursing and Nutrition series. In this episode, we are going to be discussing carbohydrates as well as other conditions, medical conditions that might affect carbohydrate intake. So, first of all, know that carbohydrates have two different groups or classifications. There's a simple carbohydrate and a complex carbohydrate. A simple carbohydrate would be a monosaccharide, meaning one. There's only one ring in that structure. So an example of a monosaccharide would be glucose, fructose, and galactose. We can then build disaccharides by putting two monosaccharides together. So disaccharides means di means two, so two sugars. So if we took two monosaccharides and put them together, that would give us a disaccharide. The other classification of a carbohydrate is a complex carbohydrate. So think of maybe foods that are considered whole grain. That would be a complex carbohydrate because it has that carbohydrate and fiber together. So maybe that would be some food examples of 100% whole wheat bread, brown rice, quinoa, legumes, starchy vegetables such as a sweet potato or corn, and even non-starchy vegetables like broccoli and spinach. All of those food examples would be a complex carbohydrate. Now, fiber is also kind of grouped in with carbohydrates. Now, remember, our body actually doesn't digest fiber, but we benefit from it in two ways. One, it adds bulk to our stools, so it's easier during digestion for our body to move stool along because our muscles in our intestinal tract, they do a wave-like movement called peristalsis. And that peristalsis, when there's something bulky for it to push against, doesn't have to push as hard to move things along. Whereas if we weren't eating as much fiber, those muscles would have to go in deeper and push in more in order to move that stool along. Fiber also can be protective against us developing some cancers. So it and can help stabilize our blood glucose levels. So fiber is so important and something that we need to make sure that you and your patients are eating every day. Now, in the large intestine, our body still, remember, we don't digest the fiber, it just adds bulk to our stools. But also, the healthy gut bacteria in our large intestine kind of feeds on that fiber. And when it does that, it can produce vitamin K. Certain conditions in which our intake of carbohydrates might be a little different include celiac disease, lactose intolerance, and diabetes. In celiac disease, it is an autoimmune disease. Our body has an autoimmune response and inflammation that occurs when we ingest the gluten. So think of it as almost like an allergy. Um, Sometimes I know when we are on the lookout for allergies, food allergies, we think, oh my goodness, someone ate that and they start to swell up. And for sometimes for celiac disease, there are more severe symptoms, but most of the time that swelling occurs inside the small and large intestine. So if you remember those microvilli with all that surface space between them, if you just use your pointer finger to trace the space between your fingers on your other hand, they actually swell and become bent. And when they do that, in that exposure of gluten, there's not as much room for absorption, and that actually leads to malnutrition. It also can lead to that patient maybe having diarrhea, bloating, constipation because of that exposure to the gluten. So if we have a patient who has celiac disease, we can recommend that they avoid gluten, but maybe still eat other foods that are high in fiber that are also gluten-free. So the sweet potatoes, corn, broccoli, spinach, legumes, the quinoa, those are all examples of foods that would still be high in fiber but be gluten-free. The next condition we'll talk about is lactose intolerance. So, lactose intolerance occurs when our body doesn't make enough of an enzyme called lactase to break down the carbohydrate called lactose. So, lactose is found in dairy products. So, think about milk, yogurt, cheese, and ice cream. So when someone is lactose intolerant, they can take like a tablet that as they're eating that would introduce that lactase into their system so they could digest it. So that's one way that they can still consume those foods. But sometimes these symptoms are so severe when there's lactose that's in the body and there's no way to digest it, that a lot of people will actually just avoid those foods that contain lactose or eat what we call a lactose free diet. They do make milk that is lactose free, as well as some yogurt products that are lactose free. So there's still food options that that person could enjoy to get the benefits of that dairy, even though they're not able to digest a food item that would contain the lactose. Know that for carbohydrates, they are so important. They are actually the preferred source of energy for our body and our brain. Make sure you tuck that in your RN tool belt. Our body needs carbohydrates in order to function. And that's not just in the moment after we've eaten. Carbohydrates and the energy we receive from them are so important. Our body actually stores it in the form of what's called glycogen, and that storage happens in our muscles and our liver. That's part of why, if someone is maybe doing a quick sprint or and continues to run, they have that extra energy as our body is using that glycogen, so that way we have that energy to function. When it comes to doing calculation questions, know that carbohydrates contain 4 calories per 1 gram. So if I had, say, a food that had 20 grams of carbohydrates in it, I would take that 20 grams of carbohydrates times 4 calories, because remember there's 4 calories per 1 gram, and I would get a total of 80 um, calories from carbohydrates. Okay, so how many grams of carbohydrates you have, we multiply them by 4. Something else that is important in when we consider carbohydrates is actually diabetes management. So, if you recall, there are two types of diabetes. There's type 1, which is an autoimmune condition in which our body doesn't produce insulin, so we cannot um, convert that carbohydrate and digest that and let it into the cell so we have that energy. That's why patients who have type 1 diabetes need to be on insulin so that way they can have the cells be open to receive that glucose into the cell. Now, for type 2 diabetes, that's when there's an insulin resistance that occurs. So the insulin is there, but the body's just not responding to it. And that's why there can be high blood glucose levels then, because that glucose just can't get into the cell. So, for type 1 and type 2 diabetes, it is important that these patients receive education and know how to carbohydrate count. It is a little bit different as type 1 will be on insulin. Type 2 diabetics may or may not be on insulin, just depending on the regimen that they're on. But it's important that they still space, no matter if they have type 1 or type 2 diabetes, that they still put carbohydrates throughout the day because we want them to still have that energy throughout the day. Um, Often that recommendation might look closer to between, say, maybe about 45 to 75 grams of carbohydrates that they're eating. Again, depending on the frequency of meals and their activity level, those numbers might be different. But we need them to still eat some carbohydrate at meals so that way they're not becoming what we call hypoglycemic or having low blood glucose levels because they're missing out on those carbohydrates. Know that you can actually pair a complex carbohydrate with a protein to help that blood glucose level be more stable and for that person to have more even blood glucose levels instead of maybe a peak and then a valley if they were to eat just that carbohydrate by itself. That protein will help to stabilize that blood glucose level. So that's what I have for you in this episode. Feel free to check out the protein episode to learn more about different proteins that could be paired with those carbohydrates. Take care and flame forward.